It's very important to me that when a patient is under my care, that we develop the kind of relationship where the patient trusts that I understand what it is that they're looking for and that they understand what it is that I can do, so that everybody has realistic expectations and that they are comfortable having me operate on them. Patients come in for consultations and I spend an hour with them. And during that hour, I make sure I understand what they want, what is concerning them, and certainly in the case of tummy tucks, I can relate, having had several children of my own. And we want to make sure that what they're looking for is something that I can do. When patients come in for tummy tuck, they're concerned about the shape of their abdomen. They have stretch marks, they have extra skin, the muscles are loose, they no longer fit in clothes. In the operating room, an incision is made in the lower abdomen through which all those muscles are tightened up again, so your tummy is flat and the extra skin is taken out, and we get to remake a cute little belly button.
From the moment I got out of surgery, I could see the difference, and it just gets better and better.
I guess you call them laugh lines?
Howdy doody lines. Are those these?
Yeah.
Okay, we can help with that. It really feeds my artistic interests, and it is immediate, and it's also extremely low risk. So can you see the difference?
The left half with filler, the right half without.
It's natural looking.
Natural, not obscene.
Not misshapen and not too long. And no, we're not going to get rid of this wrinkle altogether right here, because in order to do that, we would put so much in her that she would look weird. I say I don't like to make patients look like Goldie Hawn in the First Wives Club, and they're usually quite relieved that that's the case.
It's art, and some people are good at it and some people are not so good at it. You as the artist, the sculptress,
I think that to look at it another way, there's a lot of plastic surgery out there that's visible. So what I like to think about is the fact that I want my patients to go out to look great, to have people say, hey, you look fabulous, but what'd you do? Not to say, oh, who did your eyes?
Right. Yeah. Well, or like, as you talked about one patient, did you change your hair?
Exactly.
Where you can't see it, you just know the person looks better.
Right.
Did you get some sleep tonight?
Right. And she came in about 2 months post-op from her neck lift and said, everyone thinks my hair is fabulous. And I said, your hair. And she said,
perfect.
Yeah. They look at me, they say, you look fabulous. It must be your hair. I always say that when you go to a plastic surgeon, you get the benefit of going to somebody who can both operate on you if that's what you need, but also do less drastic things in surgery, like injectable fillers, or like the botulinum toxin A products, or skincare.
So you're buying yourself time.
Exactly.
So I can't help but notice you have a wall of diplomas back there, very impressive.
I've done a lot of training to be able to do what I'm doing now.
And one of the most important ones for anybody who is looking into plastic surgery
is to make sure that your plastic surgeon, or that the person who you're going to for this kind of work, is certified by the American Board of Plastic Surgery. That means that they have not only done all the surgical training required, but that they've passed a very rigorous set of examinations to be certified to do what they're doing.
Let's begin by telling me what you do and who benefits from it.
What I do is help people become the best that they can be, so that they go forward with whatever it is that they do every day with the most confidence possible.
Well, you're obviously successful, so what do you attribute your success to? Any particular philosophies or strategies?
Well, I work very carefully to provide very individualized care and to listen to the people that I work with, so that I am helping them do what is important to them. Being able to do this and help patients immediately and have them feel better as soon as they leave is fabulous.